Hello, and welcome to Research Minute, where you will learn about the latest in-depth research report from the Citizens Research Council of Michigan. My name is Craig Thiel, and I'm the research director of the 107-year-old Citizens Research Council. Today, I'm joined by Karley Abramson, research associate and author of the recently released report, Lack of Data Impedes Cost-Effective Healthcare in Michigan. Karley, your research into this topic reveals that the state of Michigan has dual responsibilities when it comes to prisoner health care. Can you briefly explain those responsibilities and from where they originate?
Sure. So first of all, the state has a constitutional obligation to the prisoners themselves to provide health care. Failing to provide adequate health care constitutes cruel and unusual punishment under both the federal and state constitution. So there's one component, which is the legal obligations to the prisoners themselves. There's another component about our obligations to the public, just to be good stewards of public resources and to use taxpayer funds efficiently and wisely.
Yeah, so the Department of Corrections spends a lot of money each year to operate prisons, about $2 billion. Prisoner healthcare spending is a large component of that total outlay. In conducting your research, what did you learn about the fiscal trends as well as the prisoner healthcare in the prisons?
So the overall cost of prison healthcare has actually remained relatively stable and is even trending downward slightly. It has stayed at around 300 million per year. But the costs per prisoner have significantly increased over that same time period, even after adjusting for inflation. And when it comes to the prisoner health data, we have limited anecdotal data from the state in various presentations to the legislature that talks about the prisoner population generally being less healthy than the rest of the population. And this is supported by other federal and national surveys on the subject.
I know the Department of Corrections collects mounds of information. A lot of it is related to their appropriation they receive from the legislature each year. The title of your paper indicates that there's a lack of information or a void, which kind of affects the ability to create good public policy. Can you give us a sense of what information is needed and how that would help?
Sure. So we do have some spending information broken down into a few kind of overarching categories, but not enough to really identify specific cost drivers that could be behind these increases in healthcare spending. So, for example, we don't know if there's a higher demand for certain services, if the general healthcare costs are increasing, if treatment is getting more expensive. And so having more of that granular data would inform future policy when it comes to spending. We also need to know more about prisoner health over time. So we would benefit from having information about the prisoners upon entry, after any treatment that they may receive while they are incarcerated, and upon release. And this can help us inform, one, whether we are meeting the obligations that the state has to the prisoners. Are we adequately fulfilling those legal obligations? And two, it'll help us decide where to allocate resources or change and enact new policies if we are not meeting those goals.
Thank you, Karley. We've only been able to scratch the surface of Karley's recent report. I encourage you to go to our website, crcmich.org, and look at the report yourself.